I'm Dr. E again. All right, today I would like to discuss another topic of interest on how specific diets helps in autism symptoms. Okay, so this is another common question, so often asked by a lot of parents. Okay, so let us start. Autism is often associated with difference in gut health, microbiome imbalance, problem in digestion and absorptions, food sensitivity, inflammations, mitochondrial dysfunctions, blood sugar regulations, and etc. By correcting all these through diet interventions, it helps to improve attention, focus, sleep quality, gut symptoms, or gut dysfunction like constipation, diarrhea, bloating, and it helps to reduce in irritability, hyperactivity, meltdown, and sensory sensitivity. All right. And indirectly, it could help to improve both language and learning development. All right. So, parents, diet works best when it is personalized. Now, the key point is personalized, step by step, no hurry, no rushing, no comparing, and combined with other therapy and medical care. Okay, like other therapy like speech therapy, occupational therapy, behavioral therapy, music therapy, early intervention therapy, etc. Okay, now let us go through the different types of diet that used in autism. Okay, I believe you have heard from different channel like the parent support group, a discussion among the parents, the professional, talking about diets, how diets could help your child, or improving your child with diet interventions. So sometimes you may confuse because there's just too many diets. Okay, so let me go through one by one and walk you along the way. All right, first, the commonest one will be you may come across this gluten-free, casein-free diet, or what we call GFCF diet. Okay, it removes glutens, for example, wheat, barley, flour products, and also casein, which are dairy products. Okay, how it may help? So it helps in reduce gut inflammation, improve indigestion, may help also to reduce brain fog and behavior issue in sensitive children. Okay, this diet, this GFCF diet is best for children with a lot of gut symptoms. Okay, like diarrhea, constipation, bloating, indigestive, or eczema or skin allergy, or presented with some dairy sensitivity. Right? So that is gluten and casein-free diet. Next, we come across a gut microbiome diet. Right? So it focuses on improving the whole food, encourage fiber, fermented foods, and also probiotics. Okay, so I believe a lot of parents are giving your child probiotics. Okay, so how it may help? Okay, under this diet, it helps to restore gut bacteria balance, improve bowel movement, and support the gut-brain connection. So this diet actually are best for children with constipation, frequent infections, and also a history of taking multiple antibiotic. Okay, so the next one is elimination diet, or what we call food sensitivity diet. Okay, in this diet, we advise parents to remove those triggers food. Okay, like soy, corn, eggs, addictive, artificial color, preservative, and etc. Okay, how it may help? By identify food that trigger behavior or physical symptoms. It helps to reduce inflammation and immune reactions. Okay, and this diet, this food sensitivity diet is very important or best for those children with unexplained behavior changes. Okay, like tantrums without any reason, agitations, anxiety, okay, self-hurting behavior, which could arise from physical symptoms like pain, itchiness, allergy, so these are the groups of patients or the children that actually suitable for this food sensitivity diet. Okay, next, okay, anti-inflammatory diets, okay, which we focus a lot of taking high omega-3 fats, vegetable, fruits, and herbs. Okay, and in this diet also we avoid high sugar or processed sugar or processed food, right? How it may help. So it helps to calm down the brain inflammation, support mood and emotion regulation. So who are the candidates for this diet? All right. So children with sudden irritability, aggressions, poor emotional control. Okay. Then by implementing this anti-inflammatory diet, it helps to calm down the child. All right. Okay. Next, we have this blood sugar stabilizing diet. So a lot of times, parents might hear that, oh, you have to reduce sugar, have to reduce sugar, have to reduce sugar. Why? Okay, this is the reason. Okay, and this is what we practice. Blood sugar stabilizing diet. It focuses on taking balanced diet, fat and complex carbohydrates. Okay, and also the most important thing is avoiding high sugar snacks. Okay, how it may help. Okay, it prevents energy crash, improve focus and behavior consistency, right? So the best candidate for this blood sugar stabilizing diet is those who are with hyperactivity, tantrums, and frequent hunger. Sometimes kids, mother is complaining, the kids actually eat a lot, keep on eating and keep on eating and keep on eating. Why? Because there's an energy crash by whenever they take high sugary snacks, high sugary food. So it causes frequent hunger. Wow. Okay, so I hope it helps. Okay, the next one. Another commonly heard diet is ketogenic or modified Atkins diet. But this one, please bear in mind, you need a very strict medical supervisions. Okay, so this diet actually focus on high fat, low carbohydrates, high fat, low carbohydrate. Okay, remember that. So how it may helps? It helps to improve brain energy, okay, brain energy, and it helps in reducing seizure, and also improving attentions. So this diet actually is best for those autistic child with epilepsy or seizure-like symptoms. All right, this is the most difficult. Ketogenic diet is not easy or not easy. You really need a lot of supervision and guidance from experienced parents. Okay, the next diet is low histamine diet. Okay, in this diet, we will avoid fermented food, aged cheese, processed meat, and processed food as well. So how it may help? It helps to reduce overstimulation and sleep problem. So this diet actually is best for those child or children with poor sleep, anxiety, and sensory overload. Okay, and the last one is low oxalate diet. Also another commonly being practiced by a lot of parents. So in this diet, we will advise parents to avoid high oxalate food, okay, like spinach, nuts, and chocolate. Okay, it helps to reduce pain, urinary issues, and irritability. This diet actually best for those children with unexplained type of body pain, joint pain, urinary symptoms. They go to the toilet very frequent, and extreme picky eater. All right, this is a very common symptoms complained by a lot of parents. My child is very picky. Okay, and give a try on this low oxalate diet. Okay, and take home message. Lastly, take home message is the key principle in diet bridge approach is start slow, go slow. Okay, change one thing at a time. All right. Observe behavior, sleep, stool, and appetite. Keep a journal. Okay. Record down things that you have done. For example, what are the food that you have given, what time you have given the food, and at what time the behavior, you start to notice the behavior changes. Okay. This is very important. Keep that in the journal. Okay. And work with the healthcare professional. This is also another very important. All right. And the last one is, beside healthcare professional, you can work with some experienced parents. All right. So I hope it helps. I see you again in the next discussion. Bye.